Oh, so excited to see some familiar faces. Thank you. Happy 2026. Welcome to the first support group leader roundtable of 2026. So we're super excited to have you here. And I'm going to start by sharing my screen. Oops, that's not what I wanted to do. That's what I wanted to do. It's Monday, everyone, the first Monday after the holidays. So, January 12th, 2026, we're starting again our support group leader roundtables, and we hope you can join us every month, the first Monday of every month, to connect with other leaders and share some ideas and some insights. So, to get started, we're gonna review real quick some collaboration agreements. It's important that we keep our microphones on mute because this program is being recorded and we don't want to have any background noise going on. Also, let's engage with each other. We're here to learn and share, so we ask you that you listen deeply and let's minimize the interruptions. If you need any help with some technical issues, we have our lovely friend Kiana here to help us all, and I'll do whatever I can to help as well. I'm not the expert, but I manage. And please come with an open mind to share your experiences, your tips and tricks. Ask your questions. We are here to share with each other, learn from each other, and grow together. Because that's what we're here to do. Move with purpose, bring the community together, connect, and learn. So next, we have a little chat storm that you can either type or you can unmute to answer this question. And today we want to know, how do you feel before a medical appointment? You know, especially a dentist appointment. How do you feel about that one? Or any appointment, you know, we can even talk a colonoscopy. Yikes. So before any medical appointment, how do you feel and why? Do you feel nervous? Why? So let's see that those answers. Oh, I'm sorry. And I am trying to get to my box. There you go. How do you feel? Anxious. Okay, someone responded anxious. If you can share with us why you feel anxious, that would be great. Someone said anxiety. It's an all-time high for the dentist. I agree with that, right? You never know what is going to happen. We're seeing the theme here. I feel a bit of anxiety. Well, thank you, Dave. We love your humor. Another thing to do. Just another thing to do. Good. You feel so relaxed. So, yeah, whatever. It's another thing to do. Then we have grateful. Oh, that is wonderful. Can you share with us why you feel grateful? Maybe because it takes 18 months to get an appointment with a movement disorder specialist. And after those 18 months, yay, it's finally here. Determined. Want to get all my questions answered. That is wonderful. Thank you, Katie, for that answer. Feeling determined with that medical appointment. Another one we have, it feels like a test. Huh, interesting. Will I pass or fail? That is wonderful. Thank you for sharing all those insights about how you feel about your medical appointments. And if anyone is having trouble typing, you want to unmute, let us know, raise your hand, and we can let you share that way as well. Because we know sometimes you're connecting from a phone and it's hard to type. So Karen, go ahead, please, and unmute.
Since you brought up colonoscopy or basically anything that involves anesthesia, because the new, I didn't realize there was such a higher risk for going under anesthesia with Parkinson's. And yeah, I've already had a lot of surgeries and had several and both scopes. And yeah, that there's an extra anxiety around that specifically.
A very good point. Thank you for sharing that. That anxiety over anesthesia as well. Thank you. All right. So if anyone else wants to share, I'm kind of keeping my eyes peeled here to see who's raising their hand to share. Let us know. Or if you feel more comfortable, just share in the chat. Okay. So, thank you, Dave, for sharing that insight. You know, everyone has an opinion about anesthesia and Parkinson's. And what we have to say is talk to your doctor, to your movement disorder specialist, and see what opinion they have about it. So this was fun, a lot to learn. Thank you for sharing, everyone. And we're going to move on to the next step. If I can. Oh, Bernard, you have your hand raised. Can you please share while I figure out my slide?
Sure. I was just going to add to your comment that there's one more piece we've uncovered, and that is making sure that your physician understands and has researched the issue. Because it's not just an opinion, it's what experience do you have? Because Parkinson's is not one thing, it's a lot of different things. And there's a lot of difference, variance between the people. So simply having them say it's okay for local or not okay, or it's okay, you'll be all right, is not good enough. And we experience that directly. So you might ask them as a preamble, what experience do you have with this? Could you recommend someone who's had experience with this that I might talk to?
Thank you. So powerful. Yes, thank you. That's why we love having you here, support group leaders, to share that experience. Thank you, Bernard. Lori, go ahead. You are on mute.
I'm speaking from experience as well because I was having issues and I had every kind of ostomy you can think of. I had a colonoscopy, endoscopy, all of that stuff. And they were clueless on what I needed. Absolutely clueless. And I basically was giving a Parkinson's 101 class like while I was in there. And my husband was like, do you not, she can't do what you're asking her to do, because they wanted me on I couldn't take my meds. So
Wow.
they kept telling me like I could hop down and walk down the thing to go to the bathroom. My husband's like, no, she can't. Like, so it was very frustrating. And then now that I have this pump, nobody knows what this is. So.
Mm-hmm. Thank you, Lori, for sharing.
So be informed, be prepared to teach at all times.
Yeah, that Parkinson's 101. Thank you. All right, so powerful. Thank you, everyone. And then we have a quick poll up on the screen. And we want to get, those ideas flowing. And we want to know, how often do you have speakers lead a Q&A with your support group, where they don't come ready with a presentation and slides, but they come ready to talk? What do you want to know? Let's have a conversation. How many of you have you done that? Have you done it frequently, sometimes, or never? We have some of you sharing that frequently, some of you sometimes, and one of you said never. Well, we're happy to hear that some of you are experimenting with that concept of having an expert do a Q&A. It can be intimidating sometimes, not knowing what people are going to ask and not being ready, but there is nothing wrong with saying, I don't know, let me go and find out. So something to think about for all of you. Thank you for answering the questions. And we're going to move on next to today's topic, optimizing medical appointments. Hopefully that piqued your curiosity and made you join today to learn more and to share more about how to make the most out of those medical appointments. To talk about that, we have two special guests today. And we have Giselle, who's connecting today from California. Giselle is a nurse practitioner at the Movement Disorder Center with Pacific Neuroscience Institute in California. She has extensive clinical experience and she brings her competent and compassionate care of patients to the Pacific Movement Disorder Center at Pacific Neuroscience Institute. Giselle initiated and continues to run the Life in Motion Parkinson support group for Parkinson's patients and their families. She helps moderate and lecture at the PRESS program, which is the Parkinson's Roadmap for Education and Support Services. And joining Giselle today, we have a regular also that joins our support group meetings, and that is Katie Harn. And Katie is the outreach coordinator for the Movement Disorders program at St. Joseph's Candler. Katie's goal with the Movement Disorders program is to provide compassionate, comprehensive, quality care for patients with movement disorders. The program improves access to information, services, and treatment, as well as serves as an advocate for patients. So, to talk about optimizing medical appointments, we have Giselle and Katie. And Giselle, go ahead and take it away.
Thank you very much, Clemmy, for the introduction. Very generous introduction. Let me just share with you my slide. You can see this, right? This is good. Okay. Thank you everyone for being here today. Like you, I am also a support group leader. I've also had my support group for probably about 5 years or over 5 years now too. I also started with PMD Alliance when I did start my support group. So that was a great resource and help for me. I am also the granddaughter actually of a patient with Parkinson. So I do have personal insight as well as professional. So and I'm very excited to be here today because this is, I think, a great start of the year to share with our group how to optimize medical appointments. This is one of those things. Let me just move my slide. Oh, there you go. It is one of those things that's really important because it takes a while to sometimes see our medical professionals, our providers for movement disorders. It takes months to get in. So it's really going to be important to make sure that we get the most out of those visits with our provider. So I'm glad that we're talking about it at the start of the year. That poll was really good because it tells us, and that is very reflective of a lot of the patients that come to us. There is a level of apprehension seeing your provider, even as you are excited and you want to get more information and recommendations, but there is a level of anxiety, and because of that, sometimes it just narrows things for us. So I think that this discussion today is important because it really helps us get the maximum benefit for the visits. So let me start. This is really casual, but I just have a slide just to give us a little bit more structure. So just things to review prior to the visit. So what are the motor symptoms that you are experiencing? The person with Parkinson's may have both motor and non-motor symptoms. So focus on those two things. So for the motor symptoms, are you having a lot more slowness of movement, stiffness? In the last few months, have you had many falls or more balance issues? Even if you haven't had a fall in particular, are you having near falls? Are the movements or the way you're moving, is it becoming more bothersome? Does it interfere with your daily activities? So it's really important to reflect on those things. The motor symptoms, whether there's tremor, that you're having more difficulty with activities of daily living, are they interfering with feeding yourself, or is it taking you more time to finish any task? Are those falls causing you to do visits to the hospital or urgent care? Are you having syncopal episodes? So those are the things for the motor symptoms that it's good to reflect on. And then there are the non-motor symptoms. Sometimes the motor symptoms can be very much controlled and it's not really bothersome to patients, but sometimes the non-motor symptoms of the Parkinson's can be the more bothersome to the patient. So what are those non-motor symptoms that can happen? It can be changes in mood. Are there mood swings that's happening? Are there cognition issues, memory issues, attention, focus? Are you having lightheadedness? Have you had like a syncopal episode where you just lost consciousness or felt really faint? Are there sleep issues, whether it's difficulty falling asleep or staying asleep? Are you having difficulty having a bowel movement? Are you straining? Is it difficult? Is it taking days for you to have a bowel movement? So these are things that I think can guide us as we go prepare for our visits. So what are the tips that I highly recommend? I truly do appreciate people that do write their questions, write both their motor symptoms and non-motor changes that you are experiencing, because that way it's easy for you to focus on the visit and what are the things that are important for you. Note if this are occurring, if these symptoms are mild, what is the level of severity of the symptoms? Are they mild? Are they becoming more severe as the time is going? Write down the frequency of how often this is happening. Is it just happening like once a month or maybe a few times a week? Or is this perhaps something that's happening daily? Another thing is to make a list of questions. Questions can really direct the visits in a way that is going to be meaningful to you, because if you write your questions, you'll be able to really advocate for yourself and really tell your provider what are the things that are really concerning for you. Because sometimes in a visit, there's so many things that's happening, there's recommendations thrown to you that it's easy to lose sight of that what was really important for you. So writing your questions before the appointment can be very helpful to give it a little bit more structure. Be honest. Sometimes answering questions are, a little bit difficult for patients. Sometimes they may feel embarrassed in voicing some of their concerns, but it's a very good way to really advocate for yourself, and it gives really good quality care in the side of your provider too when you're honest about your symptoms, even if they can be difficult at times too. So another thing is provide an updated list of medications. One of you did mention that. I think it was Lori who did mention a medication list. So that is really very important. Keep a current list of your medication and update it too as there are changes that occurs, and not just for your Parkinson's medications, but also your other medications, because this may affect your Parkinson's medication. Uh, like I said, I wanted to go back because there was a question about anesthesia too. So this is one of the reason it's really important to have a current and updated list of your medications, because should you have a fall or just a routine procedure like a colonoscopy or endoscopy, you are able to tell your provider, your anesthesiologist, or your medical team that these are the medications you're taking, because a lot of times there are routine post anesthesia medications that can affect your Parkinson's medication. One of those things is, as you all know, is Reglan, that is very routinely used for nausea. But knowing that you are a Parkinson's a patient that do have Parkinson's, and these are medications that you are taking, really gives them a sense too of what medications to avoid. So it's very important to have an updated list. Another thing is report any ER visits or hospitalization, whether you were admitted or not, even if you just went to urgent care. Could this be like a syncopal episode that you had or a fall that caused a laceration? Report all these things, even if you think it's not important. Like I went to urgent care or the ER because I had a urinary tract infection. This may not seem to be related to the Parkinson's, and it's not, but that will also tell you if there are cognitive changes as well, because sometimes just having an active infection can cause cognitive changes. But this is something that is very treatable, but it's important to let your provider know that this is occurring. So another thing is understand the recommendations and follow up plans before you leave. So it's really good to ask and sort of summarize what are the plans. If there is something that is unclear to you, make sure that you ask your provider for clarification. Make sure that you have information about any medication that is prescribed. For example, ask for the dose, the frequency of this medication. Ask if this is a replacement to another medication you're taking, or can you take both medications together? Timing of the medication. Make sure that you ask for all those things too. And then, what are common side effects or serious side effects that you should know about? And how will you know if this medication is working? And how will you know or how long before you see any changes as well? And if you have any questions or concerns after you started the medication, who can you call? So these are questions that I think are very important. So you have a clear pathway when you go home. So you know how to communicate with your patient, with your provider too. Other things that I think is really important and may seem like a small thing, is make sure you ask for a printout of your after visit summary. A lot of providers, at least we really make sure that we have a list of instructions for patients in terms of the medication. If there were referrals that were done for this visit, those are going to be in the printout of your after visit summary. So that way too, if there are other questions that you have, for example, if you were referred to physical therapy or an occupational speech therapy, should I be the one to contact my physical therapy for appointment, or is this something that the clinic handles? Just these little things that may give you directions and will also minimize confusion as well. Another thing that I strongly really recommend to patients is to schedule your next appointment or follow-up visit. A lot of times seeing specialists, it takes a really long time to schedule for follow-up. So it's important that while you're still there, you already scheduled for your follow-up. A lot of patients will say, I'll just call, maybe after a few months. And a lot of times, because you feel like, oh, everything is good, it's just like a routine follow-up. But a lot of times things can happen in between those times, and you don't have a scheduled follow-up. And it will take sometimes months before you're able to get in. So it's really important to already have a scheduled follow-up. That way, if you have something in between, you can probably ask your provider to be in like a cancellation list. This is something that is commonly practiced in a lot of clinics, to have like a cancellation list so they can bring a patient sooner for a more urgent appointment. But it's really good to make sure that you have a scheduled follow-up, because the reality is the Parkinson's is a chronic condition. So it is really monitored over months, right? And a lot of providers are really cognizant of that. So we don't necessarily make changes just because we see you one time and something is changing. Usually what we want to see is there has been a consistent change over a period of time versus just a snapshot of what is going on right now. Make sure to give yourself enough time to make it to your appointment. Factor in traffic, slowness of movement, and visits to the restroom, which can happen and is really true for Parkinson's patient. It is the nature of the condition to move a little slower. So make sure that you factor those in, because that also really reduces the anxiety of making it on time and not missing your appointment. This last one, I know some patients have a challenge regarding this, but it's really important to bring a companion for your visits. You can discuss roles prior to the visit as the second person or your care partner to, maybe just take notes, give permission in advance if you want them to be able to participate in the visits and give their own insights too. But it is a good practice to have someone there, because there are so many things that can happen in a visit, so many instructions, recommendations, that sometimes it's difficult to follow all of them too. So having someone there that also provides a unique insight. And sometimes there are things that the patient may not see, but the care partner is able to. I've had patients over time who come to the visits by themselves, and every time things are perfect and good until the care partner comes in, and they have a very different experience of what the patient is going through, that the patient may sometimes underreport or minimize too, because of so many reasons. Maybe they don't want to be seen as weak, or they have fears of, especially with regards to cognition and hallucinations. A lot of times patients may underreport it, but if this is something that care partners are noticing, it can be very helpful for the patients themselves too. So sometimes there may be differences in opinions, but it's good to have another person to give you a bit of a fuller picture of how it is, give us a better picture of how the last few months have been too. So those are just a few tips that I give patients, and I hope those are very helpful to you. This is just my information. If you have any questions too, feel free to send me a message. I wanted to end with this because Michael J. Fox is a very prominent picture, so to speak, with the Parkinson's community. I see possibilities in everything. For everything that's taken away, something of greater value has been given. So I wanted to end with this because it's really hopeful. And I hope that in your own groups as well, these are things that you can impart to your group and have a discussion about. And hopefully this is something that can really help optimize the visits, and that can make people with Parkinson's lives much easier as well. Thank you so much for your time. Let me just stop my share here. Thank you very much.
Thank you, Giselle. And to pick up where Giselle left off, talking about care partners, we have Katie. Katie, take it away.
All right. Well, good afternoon, everyone. Can you hear me? Okay, great. So my name is Katie Harn. I am the outreach coordinator for the Movement Disorder Program with St. Joseph Candler, and I am a certified dementia practitioner, and I have a master's in social work. So I was just looking at the chat, and I love the comment about always bringing the snitch with you to the appointment. So I love the sense of humor, but I want to address a few things about care partners and assigning one, and then I welcome your thoughts on that journey. So why do we need a care partner? And who I'm really speaking to here are the extremely independent individuals, those who are flying solo, those who will surrender their autonomy on their deathbed. I am right there with you. I see Bernard chuckling. I'm glad. I love the sense of humor, but somehow as a society, we have lost the village mentality in which we support each other. And we need to dispel this myth that doing everything alone is noble or is the only way to be independent. Everyone benefits from support. Would you think less from me when you hear that I have a neighbor walk my children to the bus stop? Am I not as good of a care partner because I hire some in-home help? for my father, autonomy does not mean doing every single thing by yourself. So I want to just reframe that a little bit. An ounce of prevention is worth a pound of cure. This is my frequent lecture to my children and to my husband and to really anyone who will listen. Of course, this quote is attributed to Benjamin Franklin. He was talking about it in 1735 in relation to fire prevention, but I still think it's very relevant and applicable today. No one will be a better advocate for your personal wishes or desires than you, or that someone that you appoint as a trusted advocate if for any reason you're unable to do it yourself. And the hope is that we will always be independent throughout the duration of life. And that is possible, but it never hurts to plan for all possible paths. So what I want to do a little bit today, very briefly, is to reframe this idea of care partners. So we want to shift our thought process from having to need help to wanting to create a plan for ourselves and our loved one. We want to take ownership of the difficult decisions. And advanced care planning, is really love in action. I know that's a little hokey, but what we want to do is any discussion that we have, and this can be formal or informal, is advanced care planning. It could be making a will. It could be talking to your children about your future thoughts. It can be announcing to your neighbor, don't you ever let someone send me to that facility across town. Anything of that nature is advanced care planning. And advanced care planning is associated with an increased quality of life for both the individual and the care partner. It's also associated with an increase in independence for the person, reduced hospitalizations, and an increased use of palliative and hospice care services. Studies have shown that people who have care partners have a better quality of life despite having worse symptoms. So most people don't even choose a care partner until they're forced to. So they might be having challenges like difficulty doing activities of daily life, bathing, dressing, grooming. They might not be able to drive, but they're still showing that they have a higher quality of life despite these challenges because they have help and support. So clinicians are really starting to acknowledge this benefit and encouraging patients to try and select a care partner. So what benefits are there to you or to the people in your support groups for choosing a care partner early, really before you might have the pressing need? In a crisis, our emotions are high, our options are limited, and we don't really have time to think through all the possible implications of our decisions. Having another's input can make the difference between something that we actually want and something that we have to settle for in the moment just to have the decision made. So we want to be prepared, but not pessimistic about the future, and know that planning reduces stress later. So time allows for more thoughtful conversations. And what I do is I talk to patients a lot about the if-I possibilities. So kind of playing this game. If I had to choose, say, for example, a therapy provider, would I like to go into a facility and receive therapy, or would I like the provider to come into my home? If I had to choose a rehab facility, would I want one closer to my home, or would I want one closer to my care partner's work? So it's just to be aware of the important providers in your area. Not all facilities are the same, and choosing the correct one can really improve your quality of life. So again, having these conversations will really help set you up for success. And when I'm talking to people about potentially choosing a care partner, so many times these top 3 myths will come up. And people will say to me, I don't want to burden my loved one. And so again, we want to reframe this conversation. Planning is a gift you give to yourself and to the other people in your life. People are not going to stop caring about you because you have a need. If you don't have this conversation, they won't really know how to move forward to speak for you. So when you're talking about what your wants and needs are, then you're not burdening someone. They're just simply parroting back what you've already decided. Also, a lot of people tell me, I'm worried about losing my independence, losing my autonomy. When you choose an appropriate care partner, this person becomes your representative, advocating for your wishes. The right person is not going to capitalize on your misfortune or talk about you like you're not in the room. You're still an active part of this decision-making process. And the third person that I hear too, or the third myth that I kind of hear about care partners is that care partners have to do everything and be very self-sacrificing. And this, of course, is not the case. Care partners can accept help and can delegate to professional or personal support services as appropriate. And so many people become stalled on this journey because they can't or they don't want to necessarily appoint a biological family member as a care partner. But there is a wealth of potential support for people in your community. You can consider neighbors, faith-based community members, social club, coalition, current or previous coworkers. The list really continues. And keep in mind that one person does not need to be your only advocate. Some people could, for instance, be designated as a healthcare power of attorney, whereas you could rely on a financial planner for any monetary concerns. You really want to know the strengths of the people that are close to you and know how to capitalize on them. And keep in mind that some people may not have the time or the resources to help as a long-term care partner, but they could be good, theoretically in a crisis until someone else is able to get into the area. So really having open and honest communication with people who you might want to ask is needed to discuss when somebody could be a care partner for you, or maybe when somebody should stop assisting as your care partner. And we are in a really unique opportunity here, as the largest segment of our country are baby boomers in terms of population. So as our population ages, there could be many more people who are looking to form these type of reciprocal relationships of care and support. There might be neighbors who might be interested in being advocates for you. It could be sharing driving. It could be sharing pet care. It could be doing any number of these things. So be open to having conversations about supporting each other. And PMD Alliance has a great ecosystem tool that can help you kind of map out your current network of who do you have that's really important in your personal life, and just identify areas for growth. And I've linked that down here. Oh, see. Oh, okay. So one of the reasons that Miss Giselle had touched on, which was wonderful, is thinking about how a care partner could support you. And really, a care partner can support you to a greater or lesser extent. It's whatever that you are comfortable with. And of course, that can be dynamic and that can be changing as your needs change and as your care partner's abilities, allow. So it can be so beneficial to have someone just objectively looking at the areas of strength and potential opportunities for help. It can be really difficult to see ourselves clearly and objectively, especially when we're in crisis. So having another person monitoring our condition is very important. If you're comfortable with it, as what was mentioned before, having someone to attend these medical appointments can be so helpful help tracking medication changes, looking at how effective your medication is, watching for side effects, helping to discuss questions and relay instructions, and even help summarize appointments. What I might think is the most relevant point of an appointment might be totally different from Clemmie's perspective. So just having that collaboration there, what's your most important takeaway can really be helpful. And one of the things I have listed here at the bottom is this idea of this triadic communication, where we have the individual with the movement disorder really partnering with a care partner and with the physician to create this open, comprehensive dialogue in which everyone is working towards the patient's self-determined goals. And that is really important, especially when you're going into an appointment. Your emotions may be very heightened. You may be worried about these test results or have a concern. And just everyone communicating very thoroughly with each other can help you get the most out of that appointment and retain the information that was given, as well as make sure you go through your list of questions that you wanted answered, right? Because I know sometimes the physician is in and out. They're really prioritizing the clinical, but there may be some things that you want to talk about. If you're making that list, like what was just recommended, then you can make sure that you get all your talking points addressed. The other thing that's so important, if you're willing, if you're interested, about having a care partner come to the appointment, is that can really help you with accountability. So the idea of having an accountability partner, especially with chronic illness, is so important because you can hold each other accountable for your diet, for your exercise, for your medication compliance, your mental health, and all of these other aspects of wellness. That can be really motivating and help you plan and meet your short and your long-term goals. So, where to start? And again, so many patients I talk with say, I get really stalled. I tried to have this conversation with my child or with my coworker, and I just felt, this is so enormous. You're not necessarily jumping into a huge marriage. You can start very slowly with a small conversation in which you say, listen, I'm worried about having this progressive diagnosis and making sure that I'm capturing the most out of my care and treatment. I was thinking about really having somebody kind of partner with me in my care to help keep me on track. Somebody might say, well, I'm not a doctor. Why are you asking me? Because you can help with the communication. You can communicate well, right? So obviously anyone you want to choose is someone who's very comfortable, who's very assertive, and who's not afraid to reiterate your needs. So, starting with that conversation could be a great idea, or you might say, I'm going to ask this individual to accompany me to a doctor's appointment just to kind of see how they do. But again, before you do that, you want to really lay out your expectations. That way you won't feel like somebody is talking over you or pushing you out of the conversation. You want to feel like somebody's joining with you, but really having that conversation about what you expect, what you would like them to do, and how they can most help you prior is so important. And I really can't overemphasize the importance of this open, honest, realistic conversation. This is the beginning of a reciprocal relationship, which can evolve over time, and discuss potential concerns and restraints in time and lifestyle. And again, PMD Alliance has a really great tool here, the Roadmap to Care, which has recommendations for people in early, middle, and late stage kind of disease progression. And that can really help you in trying to see, okay, what should I start with? Where am I going? And then here again is a potential path in the future. None of these things could necessarily happen, but just knowing the who, what, where, when, and how of where you would like to go means that you will be more likely to have your wishes respected should any of these scenarios occur. And I also created a care partner checklist, which can be dropped in the chat or we can link, which kind of just helps you think about starting that conversation of asking someone to participate in care. And then I also included the references that I had utilized and considered when creating this presentation. So does anybody have any questions, thoughts, concerns? I am a care partner myself. I was a care partner for my grandmother prior to her death for about 5 years. And I have been a care partner with my father for about the last 25 years. Unfortunately, as well, I do have a child that does have some health concerns. And so my husband and I don't have to do a lot of care partner type duties at this point, although, I feel very passionate about this topic. Even, having two adults fully functioning, attacking a problem is much better than one of us coming in. So, again, apologies if I belabored any points, but I feel very passionate towards it. And I see I have a question.
I think both of you did a great presentation, so thank you. But there's a lot to unpack, and it's certainly enough for a couple of sessions to address what you mentioned. My husband and I actually just had that very conversation with my children yesterday. We introduced what's known as a book that within the book, and I recommend it for everybody. We consolidated all of our digital diary passwords. We have financial information. We have where the will is, where the bank statements are, where you name it. I mean, I can always give you a copy of what's in the index, but it's a very comprehensive list. And it talks about medical directives. And again, this is just my thought. I didn't want to burden my children with that decision as to what to do because I was burdened with the decision with both of my parents. They felt my older brother would pull the plug right away. The other one would just take his time and that would be the end of them. And I would actually make a conscientious decision. So we chose a friend who has been through this with her husband, who will make a decision with my children and listen to them and do a group conversation. But it's a very hard decision to make. And personally, my husband did not want to get involved in it. But after doing it and having the conversation yesterday, he said, wow, what a relief. Now that we've unburdened them, we've eased their mind, we've told them that we've thought everything through. So I highly recommend having the conversation before rather than later.
Well, thank you for that. And I mean, I really appreciate, you sharing that. And I think, and again, it's hard. I don't want to digress too much, but as someone who's kind of been in that situation as well, where all of a sudden there's a crisis and you're put forward to make decisions about things that you have never spoken about, you don't know what wishes are. And medical decision making is extremely personal. People have very hardened thoughts in opposition, and that's not a bad thing, but it can be surprising. And I've come up very surprised. My brother and I have very opposing views. Even my husband and I have some views in opposition about organ donation, and similar things. So just having those conversations is so important. I can remember being very young, 20 years old, in leather pants with a cigarette dangling out of my mouth, faced by a physician saying, so what are we going to do? Are we going to take extreme measures or not? And I'm thinking, I mean, this is, I'm not the person to make this decision while I was the only one available. And so, again, planning and making that gift to someone else, because people are not going to stop caring about you when you have these needs. They're still going to love you. They're going to want to be there for you, but they might not know the best way and how. So any other thoughts?
Thank you, Katie. Yes, actually, we have a couple of questions. And Lori, I see you raising your hand, and I see your question here. How do you handle care partners that fly into a situation, say and do all the right things, but they go back to their lives?
Well, and again, please stop if anybody else would like to interject as well too. But I don't like sports. I don't know much about sports. Nobody crucify me. But don't they call those people the Monday morning quarterbackers who kind of come in and they have a lot of comments and then they leave? And so, those are the people, again, it's all going back to this open and honest communication and telling that person or persons, I love that you're willing to travel to see me, and I appreciate your thoughts. But what I need is some more consistent care, or I need a greater follow through. So, what I would like to challenge you is to say, is this periodically coming in and out? Is that the only care that you can provide? And if so, well, that's appreciated and could be considered in collaboration. I need boots on the ground here. And again, this is one of those situations where the more direct, honest, and responsible communication we can have, and it's difficult. And sometimes it's better mediated going through a third party, like a social worker, somewhat like myself, because there's a lot of feelings and history and dynamics. And again, sometimes having someone to just redirect that back to the point. We're all here to make a caring, loving plan for Miss Katie. This is what she wants. This is how we'll do it. This is how we're going to delegate it out.
Thank you, Katie, for that answer. And then we have another question from Karen that says, how do you handle life without care partners? I'm divorced and live far away from friends and family members.
Well, and so what you can do in that circumstance, I mean, I would highly recommend, and Giselle, please weigh in here. Anyone else, please weigh in here from the more clinical or just different viewpoint. I feel like you have to have someone who's there to advocate for you. Now, this could even be someone that you hire. I'm in Savannah, Georgia, and there's some different concierge nursing services that you can hire so that someone is kind of overseeing and saying, I've attended this appointment. This is what I feel. But what you don't want to do is get in a situation when you're not feeling well and somebody makes a decision that really is counter to what you would choose if you had that voice. So again, the largest percentage of our population right now is aging. You could have a friend at your church or faith-based institution. You could have a neighbor. You can build these type of relationships because chances are you're not the only person that has your loved one living halfway across the country.
True. Can I, since this is my question, can I
Please. Please.
Yeah, because Medicaid, divorce, living on a shoestring, bebopping from place to place. I haven't really had time to even get to know people well enough to ask these questions at this point. All my social connections are this way, via Zoom. Mm-hmm. And that's it. And that I'm working on it, but I do appreciate all of this. And I am glad there is these links that I can go in there. But yeah, hiring somebody is there's just no way with my current financial and newly divorced state of being. So it's a concern. But again, like you said, I know I'm not the only one in this similar type position. I'm just very grateful that so far I'm still well enough for the most part to advocate for myself, but I know I have to figure something out soon. It's just not easy to make friends that you can confide that much in, but I am very grateful for all my online groups because they know exactly what my situation is. And they do keep as close a tabs on me as they can from afar.
Well, and I would agree. And this is part of this kind of starting small type thing where, just going out and saying, you know what, I want to start a walking group within the neighborhood because I need to be exercising. I need to be going out. And then you try and get some people to come at the same time as you, just safety in numbers. So that way, some weirdo from the other neighborhood's not going to come up to you and try and have a conversation. Or if you have a fall, then there's somebody with you. You
Yeah.
might find somebody in that group that could fit this bill, you may not. But again, that's why we're starting small. Also looking at if you have a pet, who can someone theoretically to feed my cat, or does someone want to ride share to the grocery store? Those are the type of ways. And I hear you very clearly about the financial situation,
Well,
but
this is also this is my fourth temporary living situation in less than a year. And each time I move, it's in a different county. So I haven't really planted roots long enough to start these little groups, but hopefully I'm getting closer.
Yeah, but
And I
so
do think
just kind of think of those things in mind, and also think about a little bit too about reaching out to some of the other social, like the area agency on aging in your areas, or different senior centers or clubs. Sometimes you might not be ready to attend them, but they always need volunteers. Volunteering at different community places is the
I
best
did
way to
volunteer a lot.
expand the social group.
Yeah, I'm trying to get back to the area where I did a lot of in-person volunteering. In fact, I have to go in about 5 minutes here to that meeting.
Okay.
So I'm going to have to bounce out early, but thank you
Yeah.
for all of this.
Karen, just to add, I think Katie mentioned it just before, but my Department of Aging in the county, they have patient advocates, and they're available for free. Also, if you contact SHIP, which is Supplemental Health Insurance Plan, a lot of states also provide advocates that can support you.
Okay, that's something I haven't heard of before, because a lot of every county I've been in, I've tried an agency on aging, and they are most. They have not enough volunteers for people that are in bigger crisis than me. I've been
Just to add
a
in,
low priority in a lot of these different counties. So it's been a process. It's not for lack of trying. Trust me.
You're in California?
Yeah, I'm in California, right? So
try SHIP. They might be supportive.
Okay, thank you.
Right. Thank you, Karen, for sharing. We want to move on because I know we love when you have time to talk to each other. So we're going to move into breakout sessions. And the idea of the patient advocate is great. In fact, I have a patient advocate coming next month to speak for my support group, because we do have quite a few people who are living solo, and they are a great resource to have. So thank you everyone for your questions. And we're going to go into breakout sessions, breakout rooms. That's where we can share those ideas. How are we helping? How are we energizing our support group members to optimize their medical appointments? How are they getting that extra help that they need? Are they taking advantage of those patient advocates or not? So before we go, as Kiana sets it up, I know Giselle has to leave and she wanted to say something before she had to go.
I just want to thank everyone for your candidness today too. It's really great, but I wanted to also leave you with another thing too. Make sure that you have in place early on, your formal groups, your providers, your physical therapist, speech therapist, and all that. But also make sure to strengthen your informal groups, because this might be very important to you. And this could be your neighbor, this could be a friend, this could be your church, volunteer groups, senior centers in the community. These are all very important things. And I really just also wanted to highlight what Katie said in regards to advanced directives. This can be very important for you. And I know how this is such a difficult conversation. And a lot of times, this is not going to be one conversation with your loved ones, but maybe small, multiple conversations that you go back to. But it's really important to have something in place way in advance before a crisis occurs, because you are making that decision. The person with Parkinson's is the one making those decisions. And when the crisis comes, it is just the only job of your loved one is to make sure that they carry your wishes. So it removes the guilt and burden from your loved ones, because their only job is to really make sure that they carry out your wishes. So that is going to be really powerful for you, because you are putting that responsibility to someone else to carry those wishes for you. So thank you so much for your time. I know we've talked more than we our time allotted for us, but thank you very much for being here for today.
Thank you
Thank
so
you
much.
so much, Giselle.
You're
I
very welcome.
appreciate it.
Take care.
Yes,
Thank you.
yes.
So,
Thank you. I gotta go, but thank you again, and please check out the chat. For if you want to guest speaker, Robert Cochran's doing a free offer to all support groups online, and if you're within driving distance of the California Bay Area with his where we live, he'll come and see your support groups in person. So check that out too, and thank you. I wish I could be in the Q&A, but I gotta run. Nice seeing
thank you,
everybody.
Karen.
And you guys, it's been above and beyond great that you guys brought up so many great points that people really need to understand and pay attention to. Take care. Bye.
Thank you. Thank you, everyone. So, given the short amount of time we have, we're going to have only 20 minutes to talk to each other. So we're going to do 2 rooms, and please designate someone that is going to be sharing back with us, so that when you come back to the main room, you can tell us what you talked about, okay? Have fun talking in your rooms. See you in 20 minutes.
Karen, do you need help joining a room?
Back. I
I'm
am
gonna
pretty
have to
sure we
exit.
cut you off in the middle of your conversation, right? Sorry about that. That's always the case. We know you like to talk, but we also want to hear from you what you learned in your groups. Oh, you have to go, Bernard. Well, we're happy you were able to join.
They postponed my procedure until early, after lunch, and so now I got to go get ready for it. Okay. So take
Okay,
care.
well, it worked on our benefit that they
Yes.
postponed it. So good to see you. All right. So what did you talk about in your groups? We only have 2 groups, and for group 1, who would like to be the official reporter, letting us know what you guys talked about? Give us a quick summary, the highlights. And seems like Dave is the volunteer because he unmuted himself. Go ahead, Dave.
We talked a lot about the book with instructions. We talked about grown-ass kids taking care of stuff, but mostly it's keeping that book updated quarterly, twice a year. Make sure that your doc information is there, your medical, your drug information is there, but also, getting a better understanding of what we expect from the caregivers that are going to follow those wishes. And that's a loaded question. I think we could talk for hours about that. And there's going to be a lot of variations involved. But it was pretty much about that instruction book and what to do, the insurance company, the doctors, the medical, wishes. It's extensive.
The book. So I wonder how many of you have you discussed the book in your support group?
No.
I haven't either yet. And that is a very good reminder. It's like, we have to have those tough conversations in our group as well, because there might be 1 or 2 people that feel a little hesitant about doing that. and hearing from others that have done it, how they have done it, how they approach it, it might motivate them to do so. So, Karen, I see you sharing your
This is
chunky book.
it's
Wow.
it's a big book, and I did have the meeting with my support group leader. I shared with them the index and additional things that I thought were relevant, such as contact names of people if there was an emergency, doctors, medication updates. And Dave mentioned the importance of really, I mean, Bernard mentioned it too, the importance of updating the book regularly, not necessarily every week, but having eyes on it at least twice a year and somebody else looking at it at least once or twice a year.
Karen, could you send the index to that book to Clemmy so she can send it out to all of us?
Yeah, I might be able to take a picture and send it, put it in the chat.
That would be helpful. Thank you.
Yep.
Yeah, that is like a whole topic to talk about the book.
Yeah.
Right?
It took 6 months to put it together, and it does take quite a bit of time to keep it updated.
Uh-huh. Because, also like for me, the first thing that comes to mind is, how do I open the safe? Because I know all the important documents are there, but I don't even remember how to open the safe. That should be in the book.
Do you have a copy of the book, or you keep only one copy? I mean, I would imagine that you should have a few copies in several places.
That is a good point, Karen. If you're still there, I know she turned off her camera, but yeah, is just one copy enough, or should we have 2 copies?
It's just one copy. Like there's a copy of the will in it, but then there's a copy that's filed. Medical information, it's in the book, and my husband has some. It really depends, but there's just one book. Because again, it's so packed with information, you don't want it floating around.
Well, Clemmy, could we sort of collaborate on an outline to keep on the website and send a PDF out to everybody as a starting point?
Yeah.
And then build on it.
There's got to be something out there, I would think already, that's like an outline for putting something like this together. There has to be.
Right.
Yeah. But that is, great. A Google Drive, like we have right now, a roadmap to care, a guideline to the book. So that
there's so much information. Yeah.
This was an outline, just so you know.
Yeah. Beautiful. Thank you. Okay, so the book, the most important topic of discussion for Group 1.
Well, I want one thing to add from Group 1. Can I
go ahead?
Thing? I think it's important to know, and I said that your care partners, whether they change or evolve or whatever, know what your wishes are, because your wishes may change or whatever, or they may have a different belief than you, or may change midstream. So it's important that you respect the person that it's their directive. I mean, that's what I found. I ran it out with my dad. I was just like, you're gonna have to go over me and under me and through me to get him out this door and take him to the hospital. So I mean, you have to be strong in your convictions, and then your advocates have to be strong. At least one of them does, if you can't be it for yourself. So even in doctor's appointments, like, don't get bullied in the appointments. So that's my advice. I mean, I've told my husband to like stop talking. I'm like, stop talking.
Okay. So you say be bullied by your care partner during the appointments.
And your physician sometimes. Sometimes they start like yammering. I'm like, hello, I'm here. Like, it's my appointment. I mean, my husband, I love him dearly. I would never, he's the greatest thing ever. But we joke. I'm like, it's my appointment. So,
sure. Yeah. Go ahead. So I see you as DS. What is your name?
Debbie Shapiro. Debbie.
Debbie. Okay, Debbie. Sorry, now I made a mental note. Debbie, tell us.
But I just say that my neurologist suggested that when I come to an appointment, I write the 3 most important points that I want to give across, and not no more than that. In other words, what is the most important thing I want to say, and then the second, and then the third, and that's it. because otherwise you become in too much of a detailed list and you lose everything. That was his suggestion.
Okay,
Mm.
that's,
Yeah.
another approach, because if you only have 15 minutes, that's
Yeah.
kind of, a good point.
And he said too often, he says patients come to him and they talk about all kinds of little details. And as they're leaving the office, they say, and by the way, and that's really the most important thing they want to speak about. So he said, say that first.
Okay, yeah.
But Clemmy, something that we've done is we have a list of questions for every doctor's appointment. And if it's my wife, I stand by the door and block the door. And if it's me, she stands by the door and blocks the door until our questions are answered. I've had a
I
surgeon
love that.
that rip the questions out of our hands and it's okay. He answered every question there. He's just concealing where you're going to let me go. That's it, right?
Wow. Yeah, kidnapping 101.
Yep.
That's
Okay,
funny.
thank you for that suggestion. Go ahead, Lori.
The other thing, we talked about this with when we did the what's it called? Things you're not telling things your patients aren't telling you. And one of the things I brought up was like, give me like 2 minutes in the room alone with my doctor. Like, there's some things I don't want to say in front of my husband, and like I don't want him there all the time, or my mom or whoever may be with me. But sometimes you just need to be alone with your doctor, and I think that's important.
That is a very fair point as well. Yeah, wonderful insight. Thank you. So how about group number 2? Who was in group number 2? What did you guys talk about?
We talked a lot about family dynamics and how it's important to get that right person to be the advocate for you. Excuse me, and how it's not always the spouse. And we also talked about care partners who also need help and how that's okay and they shouldn't be judged for that. And I also said that I wanted to have a little Katie in my pocket to take with me everywhere I go to answer all these questions because she does it so well. But I said I want to take this presentation and show it to like every support group that I know, because everybody needs to hear this. They really do.
Yes. Yes, so we're going to have the recording, and you can use the recording of Katie's presentation for your group and cells. It's great discussion. And to your point, Lauren, I see more and more right now. I have 3 families that I have the adult child come as the care partner to support group meetings. It's so powerful because they felt mom or dad, they feel more comfortable with me. So if I'm going to go to the doctor's appointments, might as well go to the support group as well and get more information. And they come with wonderful questions that were like, we don't know. Ask your doctor and report back. So a very good point as well, who can be that care partner that can come with you to the medical appointments. So I am learning that adult children are great for that, very detailed, oriented, and tech savvy, and they take notes on their phones while we're trying to handwrite something. They are typing really fast on their phones, and they are ready right there with all their questions. So thank you, everyone, for joining today. We got a lot of content for support group leaders from this meeting today. Thank you, Katie. I took a lot of notes as well from everything you said. Lori, thank you for your inspirational comments. I copied a couple of them and shared with my team already. We learn a lot from you. You are the experts. You're doing it day in and out, helping people in your community. So we appreciate you sharing your expertise with us. And we look forward to seeing you every month for another support group leader roundtable, a time to connect, share, and learn. Thank you, everyone. See you next month.
Bye.
Thanks, Clemmy.
Take care. Bye-bye.
Bye.